And today we have very, very special guest. Alan Davidson, our president and CEO, is going to be providing the message today. Very important message.
Absolutely. Thank you so much, Alan, for joining us. I understand that CFBHN is a managing entity. Now, what does that mean and what do you do?
So CFBHN is a not-for-profit 501c3 corporation and a CARF International Accredited Services Management Network organization contracted with the Department of Children and Families. CFBHN fulfills its mission by contracting with community service organizations to provide a full array of publicly funded mental health and substance use services in the 14 counties that comprise the Suncoast region. Services include acute care, residential treatment, housing, medical, outpatient, recovery support, and prevention.
Right. Now, Alan, this month is very special month for persons concerned about their mental health well-being, correct?
It is, yeah. It's Mental Health Awareness Month in May, and we should be checking in to find out how is everybody doing. In case you missed it, Sesame Street's lovable Elmo posed that very question on social media earlier this year, and the responses came flooding in. From the relationship problems to financial troubles and feelings of exhaustion, angst, loneliness, and disconnection, people shared their struggles. At last count, Elmo's post had garnered more than 217 million views, 15,000 reposts, 165,000 likes, and 45,000 responses on one social media platform alone. What this helps reveal is that many of us are not okay, and it's important to acknowledge and address that and make sure people know help is available. That's why CFBHN exists, and we have services and supports to help you be okay.
Fantastic. Now, does mental health conditions affect just certain groups of people at certain times in their lives?
No, ma'am. No, mental health conditions can affect anyone, regardless of gender, age, race, ethnicity, or income level. Recent data underscores that our nation is facing an unprecedented mental health crisis among people of all ages and backgrounds, including young children and older adults. To put this into perspective, if you were standing in a room full of people, at least one out of every five of those people likely experienced anxiety, depression, or other mental health conditions in the last year. The good news is mental health conditions are treatable, as illustrated by many athletes, entertainers, and prominent public figures who have spoken openly about their experiences. People living with mental illness can lead happy and productive lives. At CFBHN, we are committed to increasing access to mental health services and supports. We understand that many Americans may feel reluctant to reach out for help or to seek care. We want you to know that we see you, we hear you, and we support you. We believe that with the right care, anyone affected by or at the risk for a mental health condition can achieve well being and thrive. And if you take care of yourself, you might also be a support for others, a lifeline for someone else.
Indeed. So what can we all do now to make sure that we take care of ourselves and others?
Well, May 16th is Mental Health Awareness Day, and it provides an opportunity to take the next step from awareness to action for yourself, a loved one, or your community. This could be as simple as adopting a positive mental health habit like eating a balanced diet, getting a good night's rest, or exercising, or offering support to a friend or family member who is struggling.
Thank you so much, Alan. Miss Doris, wrap things up for us.
Well, as you know, we always are talking about having the families talk to their children about staying away from underage alcohol use, and Talk They Hear You is our campaign. Certainly come to our website, receive the resources you need, and talk. They hear you. Go to www.cfbhn.org.
Because we're in it to win it.
Yes,
That's
ma'am.
right. That's right.
CFBHN.org. Alan, thank you so much. Thank you, Miss
Great. Thank
Doris.
you.